If you have neck pain, I want to tell you some ways that you can help to stop the pain or get out of that pain. I want to know who I'm talking to, though. If you're having neck pain, just put a yes in the comments below. If you're having no neck pain, you're just watching this for information, then just put a no in there. Love to hear from you. So whenever we're talking neck pain, obviously the first thing you want to look at is, what's causing the neck pain. And the top three causes are really going to be muscle, nerve, and disc. Those are the primary causes of neck pain. There's other things that can do it, but those are the most common ones. So let's start with the most common, muscle. If you're having a tight muscle, and really that's all that it is, it's not a nerve or it's not a disc or those kind of things, usually it's going to be short-lived, a couple days, and it's going to go away. You can massage it. You can use ice pack on it. Just put some ice right on the area where it's at, or you can even stretch it. So for neck pain, you'd want to do some stretches where you just gently stretch the neck side to side. Just do a gentle stretch, not pulling too hard or anything like that. A gentle stretch. Do all the ranges of motion, rotation, extension, forward flexion, etc. So do all of your motions, stretch it out, rub it, put some ice on there to relieve the pain, and most of the time that'll be gone in just a couple days. If it's there longer than just a few days, now we have to start going, okay, what else could be the problem? And if you're looking at the fact that the next step up, so to speak, is a nerve, that's where I, as a chiropractor, would come in. We do a neurologic exam. It includes all 9 factors for neuromusculoskeletal problems. In other words, nerve and muscle together causing your pain. Now, whenever you have that, you do the exam, you find out exactly what's wrong. Once you know what's wrong, and you'll know how to treat it. And so we do an exam to find out, number one, what is it? Is it just a muscle? Is it the nerve? Is it the disc? Is there something else going on? And I can actually look in and find some of the other causes. But if you're having any kind of issue in the neck, remember, put a comment down below. Say, yes, that's me. Or if you have a question about neck pain, put it in there. If it's lasting longer than just a few days, then I would say definitely stop, take a minute, call the office, and set up a time to get an exam, 724-342-2225. The reason I would say that is you want to find out right away. I had somebody in not too long ago, matter of fact, it was within the last month, and what they had going on was something that had been in there for years and years and years, and they kept just thinking, it's going to go away, it's just a tight muscle, I just work really hard. All the things you hear people use as excuses is why they don't really want to kind of slow down and get out of pain. And after doing the exam, I found out that they had a lot of degeneration, which showed up because the bone had moved in a wrong position and healed that way. If your bone is in a wrong position, rubbing and wearing and tearing, and it heals that way, it's going to stay that way permanently. We don't want to see it with permanent problems because you let it go too long. If you've had a neck pain for any length of time, then definitely look at it and say, okay, is this just a muscle? If it's just a few days, hey, let it rest. Maybe that's all it is. If it's been longer than just a few days, I'm going to say get a checkup, find out, can you be helped? And then, of course, if it's been a really long time, immediately you want to get checked. This could end up being a chronic problem. There may be some solutions for it if you haven't waited too late. That's when we'd want to stop and say, okay, you've had it too long. We need to do the neck pain severity exam. Now, what that means when the neck pain severity exam is when you're going to do find out how bad it is. In other words, we're rating it on a scale. Up to 85%, you can still help it. Beyond 85%, 86 and higher is usually when you're really just going to be living with that pain to some degree the rest of your life. The question is, can you get any relief at all, or how much can you get? But you're going to have some pain the rest of your life. But that still doesn't mean, even if you think that's you, that still doesn't mean don't get checked, because there's some amount of pain you may be able to get rid of. Maybe you're only going to be stuck with 20%, but you're still suffering at that 80 or 100% pain level, and you didn't have to. So I'm going to just say, try these methods, try the stretching, try the ice, try the massage on the neck. And if that doesn't do it, definitely get into the office, come down, get checked, find out what the severity of your condition is, if it's chronic. And if it's not chronic, obviously find out what you want to do to get your body better. So hope this helps. And again, this is Dr. Jason Tripp. And I'm looking forward to talking to you. If you have any questions, leave comments below. If you have concerns or anything you want to ask, just leave that comment below and I'll answer it for you as soon as I can get to it. I'll talk to you soon.